SAA can help in cases of colic at multiple levels. On farm, it's most useful to help determine if a horse may need to be referred to a referral hospital for advanced care. Most causes of colic that cause increased levels of SAA also are going to require that increased level of care. At a referral hospital, SAA can also be used to help differentiate between inflammatory etiologies such as colitis or enteritis or peritonitis, where the levels will be particularly elevated. And then it may also be elevated with other severe disease processes such as small intestinal lesions or horses that present with SIRS. When we've eliminated those inflammatory causes of colic, then it can be used at that level to try to determine whether or not a horse should be taken to surgery. In and of itself, it's not going to be an indicator that a horse requires surgery, but it can be part of the picture when you're evaluating, as the levels tend to be higher in horses that need surgery versus medical management. It's important to note that SAA will not be increased in severe acute problems such as a colon torsion. As we know, those tend to progress and lead to death within 4 hours after they've happened, and SAA does take about 12 hours to start increasing. So it's just an important thing to keep in mind when making decisions like that we have to have the other clinical variables such as pain or other indicators of severe disease when we make that decision of whether to go to surgery. So following colic surgery, SAA will increase in a normal post-operative recovery, but that's to be expected because the horse just underwent an inflammatory event when they had surgery. So it'll tend to peak about 72 hours after surgery, kind of depending on the lesions, and then will gradually decrease from there over time. This doesn't mean that it can't be used for monitoring, however, because if the SAA fails to decrease after that time point or is decreasing and then spikes again later, we still have some indication then that there could be a complication such as catheter site infection, incisional infection, or other complication internally that we can't observe from the outside. So SAA can help us monitor that and make sure that the horse is recovering normally. At the very least, the horse should be tested prior to discharge because if it still has significantly elevated SAA, probably should not be discharged to the owner.